Bismillahirrahmanirrahim. Today's station is mechanism of labor. So what the mechanism of labor is, basically mechanism of labor is the alteration in the fetal attitude, position of the presenting part and fetal body during passage through the of fetus through the birth canal. This is the birth canal and this is the fetal head. So a number of changes occurs, cardinal movements basically in the fetal head while passing through the birth canal. This is called the mechanism of labor. So what the attitude is, basically attitude of the fetus is the relationship of the fetal head and its limbs to the trunk, and normally it is flexion. What the presentation is the fetal part that lies in the lower pole of the uterus. So that is presentation, and the prominent part is called the presenting part. So normal presentation is cephalic. When the head is in the lower pole of the uterus, it is cephalic, and the prominent part is the vertex. What the vertex is the presenting part. So what the vertex is basically the area bounded between the anterior and the posterior frontanelle and two parietal eminences. So these are the four boundaries of the vertex. Vertex is the area between these two frontanelles and these two parietal eminences. So this is vertex, and the prominent point on the vertex is occipit, okay, by which we can know about the position of the fetal head in the pelvis. So to memorize the mechanism of labor is a mnemonic add fire. What the add fire is engagement, D for descent, F for flexion, I for internal rotation, R for restitution, and E for external rotation. Okay, so what the engagement is, basically this is the pelvis, this is the pelvic inlet, and in between there here is the pelvic mid cavity, this one, two ischial spines, and this is the mid cavity, and this is the outlet. In outlet, the anterior posterior diameter is this and the transverse diameter is this. Actually the inlet is just opposite to the outlet. In inlet, transverse diameter is greater than the anteroposterior diameter, and in outlet it is anteroposterior diameter is more than the transverse diameter. So engagement occurs when in the head in the transverse direction. So like this is the transverse direction. In this way the baby lies in the maternal abdomen, in the uterine cavity. So this way the head descends into the pelvis, and when the biparietal diameter crosses the pelvic inlet, this is called engagement. So engagement occurs in the transverse direction. Why? Because the transverse diameter at the pelvic inlet is more than the anteroposterior diameter. So the engagement occurs after engagement. Achha, next, what is the descent, and what force, that is the chief force for driving all these steps of mechanism of labor? This is the uterine contractions. Force comes from the uterine contractions. What during labor, what happens during uterine contractions? In each contraction there is shortening of the uterine muscles, leading to the reduced space of the intrauterine cavity. So this helps in the descent of the fetus. So with further uterine contractions, what happens? Flexion occurs. What the flexion is? Flexion basically is head descent engages in the transverse diameter, and then flexion like this. When the flexion occurs, the diameter that comes into the cavity is occipito-bregmatic. Occipito-bregmatic is the most favorable diameter for the normal vaginal delivery, that is 9.5 centimeter. So this comes so that it accommodates in the mid cavity, that is the narrowest cavity of the pelvis. After it comes into the narrowest cavity of the pelvis, then further uterine contractions helps the head to descend further, and then now you can see from this side that the occiput, when the occiput touches the pelvic floor, the muscular pelvic floor, it will rotate anteriorly. Okay, so it will rotate like this, like this will engage, and then descent occurs, and then it will rotate anteriorly like this. This is the pubic symphysis, and this is the occipit, and it will rotate anteriorly. So engagement occurs, then flexion, and then internal rotation at fire. Now restitution. Now the baby delivers with the help of extension, by the process of extension. This way the baby will deliver, this way. So after delivery of the baby, restitution occurs. So the delivery occurs by the process of extension like this. So after delivery, there is twisting of the neck. So because the shoulders comes into the pelvis, and they are not rotating to same degree as the head is rotating. So the moment of the head is released, outside the introitus, the head tends to regain its normal right angle position with the shoulder with a jerk. So this jerky movement is called restitution. After restitution, external rotation occurs. What the external rotation? Because now the shoulders, they are coming obliquely or transversely within the pelvis, entering into the pelvis. So the head lines itself with the shoulders. So the external rotation will occurs like this, because now at this moment the shoulders are in the AP direction. So the head is at the right angle with the shoulders, so it is like this. The head delivers with the process of extension, then it rotates 1/8 of a circle to untwist its neck, and then further rotation to 1/8 of a circle occurs, and head lies right angle to the shoulders. So this is the normal position. This is called the external rotation. Then the shoulders comes into the AP diameter, and the shoulders will deliver by the lateral flexion, and then the rest of the body is delivered, and the delivery occurs.